The relationship between renal health and proper nutrition. Let's start with a basic definition. Kidneys are a pair of organs whose job is to filter all your blood and remove any waste. They also manufacture and release hormones that keep your blood pressure steady and regulate the number of red blood cells in your body. As the blood in your bloodstream passes through your kidneys, the waste materials are removed and sent to your bladder to be later expelled from the body. In a single hour, a pair of healthy kidneys processes more than 18 gallons of blood. In a single day, that adds up to about 432 gallons of blood. Kidneys filter more than half of all of the fluids in your body and can eliminate more than 2 quarts of urine per day. Kidneys, for all their hard work, or perhaps because of it, are prone to a number of disorders, like infections, kidney stones or chronic kidney disease. All of these are serious problems and can lead to complete kidney failure. Kidney failure, also known as renal failure, can be acute or chronic and is usually noticed when a physician detects increased serum creatinine and a decreased glomerular filtration rate. There are a number of symptoms associated with renal failure, such as the following: higher concentrations of urea in the bloodstream, vomiting or diarrhea that can lead to dehydration, nausea, loss of weight, nocturnal urination, foam or bubbles in the urine, blood in the urine, an increased need to urinate or higher amounts of very pale urine, bladder pressure or difficulty in urinating. Renal failure can also produce phosphates in the blood, itching, damage to your bone structure and muscle cramping due to low levels of calcium. It can also lead to a buildup of potassium, which can cause abnormal heart rhythms and even muscle paralysis called hyperkalemia. Hypertension increases the risk of renal failure, especially if it is untreated. Gout, diabetes, prolonged shock and certain drugs can also contribute to the risk. More than 26 million Americans are living with chronic kidney disease and millions more are at a high risk of developing it. Chronic kidney disease does not have to become kidney failure if it is detected early enough. People who have chronic kidney disease also develop heart disease. In fact, it is the #1 cause of death for those with kidney disease. Not only is hypertension a major risk factor in developing chronic kidney disease, it can also be caused by renal disease. Just about everyone with chronic kidney disease will develop hypertension at some point. Those most at risk to develop chronic kidney disease are those with a family history indicating such. Diabetes is also a big risk factor. Certain ethnic groups are more likely to develop kidney problems as well, including those of African American, Hispanic, Pacific Islander and Native American descent. What can cause kidney failure? Hypovolemia, low blood volume, which can be caused by the loss of a lot of blood, dehydration, using diuretics, the blockage of renal veins or arteries, a powerful infection, significant muscle breakdown in the body, trauma to the kidneys or a crashing accident. These things that affect the kidneys may be only temporary or they may be potentially fatal. Sometimes treatment is easy. Proper medication can clear everything up. Sometimes a kidney transplant is necessary. It is possible to live with only one kidney, but considering how much work they do, it is never a good idea because of the considerable stress that one kidney will suffer. High blood pressure is sometimes an indicator of kidney disease since kidneys secrete blood pressure regulating hormones. How to feed your kidneys? Of course, if you have a chronic condition, you should see a doctor about it. You may have changed dietary needs and your doctor can help you figure out which vitamins, minerals and other nutrients you need to supplement or cut back on. There are some macronutrients that can be dangerous to those with chronic kidney disease. For instance, protein should be limited for kidney disease patients, at the recommendation of a nutritionist. Protein is a necessary macronutrient, but kidneys that are not functioning properly will not process excess protein well. If you have to limit the amount of protein that you're taking, it's important to use a source high in quality protein and low in fat. ProfectR, a liquid protein supplement shot from Protica, is only 100 calories but contains 25 grams of protein in every tiny 2.9-ounce serving. Make sure this is within the limits of the protein allowed by your doctor or dietitian. An overabundance of protein in your diet can lead to ketosis. This means that your body will stop burning carbohydrates to get its energy and will begin to burn fat instead. This fat is reduced to bits of carbon known as ketones, which are released into the bloodstream. Ketosis suppresses the appetite while increasing the amount of urine to be eliminated. Eventually, this can cause dehydration, electrolyte imbalances and even osteoporosis. The American Heart Association suggests that about 35% of all calories taken in per day should be protein. That can be too much for someone who is in the beginning or middle stages of chronic kidney disease. Work with your doctor and nutritionist to find the best balance of macronutrients for you. Those macronutrients, fat, carbohydrates and protein, are necessary for life, but careful planning is needed to avoid making a kidney condition worse. The proteins consumed should come from the lower fat varieties, like proteins from plants. Kidney stones. Kidney stones are another problem that kidneys sometimes face. It is one of the most painful experiences that one can suffer. Unfortunately, it is also one of the most common. Most kidney stones will pass without any aid from a doctor, but sometimes treatment is necessary. Caucasian men between the ages of 40 and 70 are the most likely to develop kidney stones, while the danger for them peaks at age 50 for women. Factors such as family history highly influence the development of kidney stones, as do the presence of certain metabolic disorders.